Hi everybody, my name is Lucinda, and we're here to talk to you about coming home from the hospital after an episode of coronavirus. Coming home to safety videos are for anybody involved in post-coronavirus caring, family members, friends, and patients too.
Hi, I'm Lauren. Coming out of the hospital from any serious illness can be confusing. We're hoping that our COVID-19 coming home to safety videos will make things a little easier and simpler for you. That and something that's probably totally on your mind if you're watching this video, less scary.
Here's the thing. One way to feel less scared is to take control of a situation. Take as much charge as you can in getting ready for your loved one or you to come home from the hospital.
We understand, of course, that all the planning in the world that you do won't take control of the thing you want to take control of, the coronavirus. We wish we had some magic formula for you on that, but we don't. We do have some thoughts, though, on how you can organize things in a sensible way. We know they won't solve all your problems or anything close, but they will give you some power to control the things you can. Don't sell that short. It's a good thing.
Our first video about coming home from the hospital is actually about things you can do while the patient is still in the hospital.
But before we get into things to do, there's one more thing we want to make clear.
Crystal clear.
Absolutely clear.
What we're going to talk to you about is not supposed to replace doctor's orders.
You have to follow your doctor's orders.
Follow your doctor's orders.
Let me clarify. Follow your doctor's orders. They're the core of any treatment to keep a patient alive and get them better.
In fact, the purpose of coming home to safety is to make following your doctor's orders easier.
Now that we've gotten that straightened out, ready to get down to some to-dos?
I'm all about to-dos, so let's do it. We're going to start by helping you get ready for that day when your loved one or you comes home.
And if you or the patient you're taking care of is already home, don't sweat it. It's never too late to get stuff done. And you might have done some things we're going to mention already.
Now, when you finish this video, you'll be able to download a series of straightforward, not very long to-do lists, like collecting important phone numbers and stuff to order. As much of that stuff that you can get done before a patient comes home, the easier everybody's life is going to be.
Some of them will be easier to do than others. Gathering the phone numbers for 911, easy. Jotting down your pharmacy's number for most people, probably not as hard, but not necessarily for everybody.
But some numbers might be a little more challenging to find, like the numbers of the companies that will be providing medical equipment like hospital beds and oxygen, if you're going to be using them. It's important to have those numbers, not just for ordering, but also because those sorts of things often need servicing. And hopefully, when things are looking sunnier, that hospital bed and the oxygen machine can be returned.
Gone forever. Goodbye.
Even if it seems that way now, this isn't going to last forever.
And finally, the important lists. Favorite takeout restaurants. Go to movies to stream. We even have places to get more lists of the best movies on Netflix, Amazon, Hulu, Disney, iTunes, YouTube, Vudu, Pluto, Sling, Fumo, and Crackle. Popcorn flicks.
And my favorite, Tubi TV. Not really. The point is,
we're not kidding about little pleasures for yourself being important.
This is a hard situation.
And we all deserve some soft once in a while, especially people like you.
Especially kind, brave, and here's the boring one, responsible people like you.
Lucinda and I are going to close by saying this to you. Thank you for your courage. You're being so brave by taking care of someone who's been seriously ill, even if it's yourself. So here's the first thing we want you to do, even before you start on the lists. Recognize that. Thank yourself.
Recognize how brave you are. And while you're at it, throw in compassionate and kind. Give yourself the credit you deserve.
Our thoughts and hope and love are with you.
And don't forget my prayers. They are with you too.
See you tomorrow.